Well, good morning, everyone, and welcome to the final exit briefing for the Epi-Aid that investigated undetermined risk factors for suicide among youth in Fairfax County, Virginia. At this time, I'm going to ask those of you who aren't talking to put yourselves on mute for the time being, and then when you have the opportunity to do introductions and have questions and discussion, you can unmute. This is Erica Spies from CDC, and I was the lead Epidemic Intelligence Service officer on this investigation. And this exit briefing represents the conclusion of CDC and SAMHSA's investigation and is an opportunity to provide an overview of findings and allow for the community to start having discussions about their next steps. The dissemination and use of the final report will be led by Fairfax County Health Department and Fairfax County Public Schools. So here is an outline of the exit briefing for this morning. On behalf of the team members from CDC and SAMHSA, I will be providing an overview of findings from the final report. We will also allow some time at the end of my summary for some questions about the methods and findings, to be followed by Fairfax County Health Department and Fairfax County Public Schools discussing next steps for the community. We will conclude with additional time for discussion. Before we get started, I would like to acknowledge the following individuals, agencies, and organizations for their assistance in the completion of the investigation. I would also like to thank fellow EIS officers, Dr. Kristen Vanderendy and Bridget Gleason, and Dr. Ashi Ivy Stevenson from the Division of Violence Prevention at CDC, as well as Dr. Sean Lynch and Dr. Chipper Jean at SAMHSA for their work during the investigation. In 2014, there were 16 deaths by suicide among youth ages 10 to 24 in Fairfax County, Virginia, prompting the local public health officials, public school system, community members, and parents to be concerned particularly about suicides among youth in the Fairfax County public school system. Death by suicide was given local and national mass media attention, as well as social media attention. Information about youth deaths by suicide was spreading rapidly about the community, heightening many community members' level of awareness. Although the community had previously dedicated extensive resources to suicide prevention activities, there remained concern about unidentified risk factors since youth suicides had continued to occur. And in October 2014, there were 3 suicides among high school students in the Fairfax County public school system, which occurred in close physical proximity and time. CDC and SAMHSA conducted an Epi-Aid investigation in November 2014. As a reminder, an Epi-Aid refers to an investigation of serious and urgent public health problems in response to formal requests for rapid assistance from states, federal agencies, international organizations, ministries of health from other countries. Epi-Aid teams consist of at least 1 EIS officer and other staff who can provide epidemiological assistance. The overall focus of public health is the safety and well-being of entire populations. Central to this field of public health is the tenet to provide services that benefit the largest number of people. Therefore, a community and multi-school approach to the Epi-Aid was taken in Fairfax County. This public health approach is a 4-step process rooted in the scientific method that can be applied to various health problems that affect populations, including suicide. Steps include number 1, define and monitor the problem. Number 2, identify risk and protective factors. Number 3, develop and test prevention strategies. And number 4, assure widespread adoption. Epi-Aids allows CDC to provide assistance to local and state health departments' work through steps 1 and 2, and to provide recommendations for the development and implementation of intervention strategies. For this Epi-Aid, a 4-level social ecological model was used to better understand the magnitude of suicide among youth in the county and to identify risk and protective factors and recommendations for potential prevention strategies. The social ecological model considers the complex interplay between individual, relationship, community, and societal factors, and recognizes that prevention strategies should include activities that address multiple levels of this model. More detail on the framework can be found in the final report. The investigation had 2 objectives. The first was to assist the Virginia Department of Health and the Fairfax County Health Department in examining trends of fatal and non-fatal suicidal behaviors among youth from September 2010 through 2014 in Fairfax County, Virginia. And the second was to identify risk and protective factors associated with fatal and non-fatal suicidal behaviors among youth to help inform prevention strategies. A mixed methods approach, meaning the use of both qualitative and quantitative data, was used to meet these objectives. I will be sharing an overview of findings provided in the final report. More detailed information, as well as school fact sheets, can be reviewed in the final report document. The first objective was to examine fatal and non-fatal suicidal behaviors among youth. Fatal and non-fatal behaviors were examined because youth deaths by suicide account for only a fraction of the impact of suicide. For each death by suicide, there are many more hospitalizations, emergency department visits, and events that involve no formal medical care. Therefore, to examine trends in fatal and non-fatal suicidal behaviors among youth, 4 data sources or systems were used. Trends in fatal behaviors were examined using the Virginia Violent Death Reporting System, or VDRS, and the Virginia Office of the Coroner Medical Examiner, or OCME data. Trends in non-fatal behaviors were examined using the Virginia Electronic Surveillance System for the Early Notification of Community-Based Epidemics, or ESSENCE data, and the Fairfax County Fire and Rescue's Emergency Medical Services, EMS data. I will now share some findings. Beginning in 2003, the Office of the Chief Medical Examiner in Virginia implemented the National Violent Death Reporting System. It is funded through CDC and currently operates in 32 states. This data system links information about violent deaths, including suicides, from sources such as law enforcement, medical examiner, and vital records. The system compiles information on violent death from all sources and allows for examination of circumstances that led up to or contribute to a violent death. Virginia VDRS data were used to calculate suicide rates. The overall suicide rate for Fairfax County for those ages 10 and older in 2003 through 2012 was 7.9 per 100,000 persons. The rate for 10 to 19-year-olds was 3.3, and the rate for 20 to 24-year-olds was 10. Suicide rates for all age groups in this time period in Fairfax County were less than the overall national suicide rate. Let's take a closer look at the rate of suicide among 10 to 19-year-olds, since the community was specifically concerned about suicide in its student population. It should be noted that these rates were calculated with fewer than 20 cases and may be unstable. Therefore, they should be interpreted with caution. Virginia VDR staff had previously calculated rates among this age group in Fairfax County from 2003 through 2012. They also calculated the preliminary rate for 2013 at the request of the Fairfax County Public Schools and Fairfax County Health Department. These rates range from 0.7 to 6.9 per 100,000 among 10 to 19-year-olds. Currently, only data through 2012 is available in VDRS. Therefore, VDRS data were supplemented with information provided by the Office of the Chief Medical Examiner. The data represent all cases recorded by the Office of the Chief Medical Examiner where individuals between the ages of 10 and 24 died by suicide either in Fairfax County or with a residence address of Fairfax County. This is the Epi curve for suicide deaths among youth from September 2010 through October 31st, 2014. In this time period, there were 85 deaths by suicide among youth. Data from the Office of the Chief Medical Examiner was used to look at deaths from January 1st, 2013 to present. I will now describe the decedent characteristics. Approximately 3/4 of decedents were male, 45% were between the ages of 10 and 19, and 69% were white. The 2 most common methods of suicide were hanging and gunshot wound at 38% and 32% respectively. 21% of decedents tested positive for alcohol, and 25% tested positive for drugs at autopsy. Presence of alcohol or drugs at autopsy was examined over each year. While not statistically different, the percent of decedents who tested positive for alcohol or drugs at autopsy has fluctuated across years. In 2013, approximately 60% of youth who died by suicide tested positive for either alcohol or drugs. This table summarizes the circumstance data from both VDRS and OCME sources. The most common characteristic of suicide among youth was current mental health problem at 72%, followed by mental health treatment in the last year at 48%. Now we will look at non-fatal behaviors. ESSENCE is a syndromic surveillance system that is used to monitor for outbreaks and health conditions of concern. The Fairfax County Health Department searched for keywords in Emergency Department Chief Complaint records related to suicide and suicidal ideation from January 2010 through October 2014 for patients with an age range of 10 to 24. 1,703 emergency department visits with a chief complaint of suicidal behaviors and/or ideation were identified between this time period. It should be noted that the fourth quarter of 2014 is only complete through October 31st. From this graph, you can see that the number of visits doubled between the fourth quarter of 2012 and the first quarter of 2013, and this increase has been maintained. I will now describe the characteristics of the emergency department visits. Almost 2/3 of visits were made by females, and nearly 2/3 of visits were made by youth between the ages of 10 and 19. Over 60% were made by white youth. 71% of chief complaints were characterized as suicidal or suicidal ideation, and 29% were classified as a suicide attempt or non-fatal behavior. 67% of non-fatal behaviors included substance use of some kind, while 10% included cutting. 59% of visits resulted in discharge, 20% in admits, and 15% being transferred. There was a statistically significant difference between 2010 and 2014 in the percent of patients with a chief complaint that included substance use, with the lowest percentage being in 2012 at 2% and the highest percentage being in 2014 at 29%. Finally, data were queried from the Fairfax County Fire and Rescue's data warehouse for all dispatched suicide responses occurring between January 1st, 2010 and September 30th, 2014. The age range of individuals who receive services, the age of individuals who receive services from EMS for suicide-related behaviors of suicidal ideation was only available for 746 responses, representing only 39% of those dispatched. Of these, 263 known suicide-related responses among youth were identified. This Epi curve shows the distribution of the 263 known dispatched youth suicide responses from January 2010 through September 2014. 56% of patients were female and 58% were between the ages of 10 and 19. The most common primary impression of the response was behavioral or psychiatric disorder at 45%, followed by traumatic injury at 23%. The majority, almost 80% of patients were treated and transported, 12% refused treatment, and 7% were pronounced dead at the scene. Now let's move on to the second objective, which was to identify risk and protective factors associated with fatal and non-fatal suicidal behaviors. In addition to the data sources previously discussed, the Fairfax County Youth Survey, Virginia Secondary School Climate Survey, focus group with parents, interviews with principals and directors of student services, and the review of news stories were used to meet this objective. Again, I will provide an overview of findings associated with each. The Fairfax County Youth Survey is an annual, comprehensive, anonymous, and voluntary survey that examines behaviors, experiences, and other factors that influence the health and well-being of the county's youth. The recent survey data that we had was collected in the fall of 2013 and resulted in responses from 32,439 students with a response rate of 89%. Two logistic regression models with the dependent variables of having seriously considered suicide and attempted suicide were run using the Fairfax County Youth Survey data. Independent variables included demographics and variables at the individual level, such as drinking and drug use and perceptions of resilience, and at the relationship level, having parent help available or experience of intimate partner violence. The tables on the next two slides summarize the statistically significant risk and protective factors for both outcomes. Results show similar relationships between independent variables and both dependent variables. For both seriously considered suicide and attempted suicide, demographic and individual level risk factors included being female, feeling so sad or hopeless, and lifetime drug use. Sensation-seeking behaviors were a risk factor associated with seriously considered suicide. Protective factors included perceptions of individual resiliency and 6 or more hours of sleep. For both seriously considered suicide and attempted suicide, relationship-level risk factors included victim of cyberbullying and experience of family conflict and general violence. Victim of bullying was a risk factor for seriously considered suicide, while experience of intimate partner violence was a risk factor with attempted suicide. Protective factors included having parent help available and feeling safe at school. Full regression analyses and school-specific analyses are provided in the final report. The Virginia Secondary School Climate Survey is a component of the annual school audit in the state of Virginia that is required by law and overseen by the Virginia Center for School Safety. 5 scales are used to summarize key aspects of school climate and include disciplinary structure, student support, academic expectations, student engagement, and prevalence of teasing and bullying. Items in the Virginia Secondary School Climate Survey also assess students' expectations about pursuing post-secondary education and involvement in extracurricular activities. The number of extracurricular activities students reported being involved in range from about 6 to over 8 in Fairfax County. Those expecting to graduate from a 4-year college range from 27 to 47. To explore risk factors beyond the individual level, qualitative data were collected. 6 focus groups with 71 parents and interviews with 8 high school principals, 8 high school directors of student services, and 2 middle school directors of student services were conducted. Schools were selected based on the prevalence of youth suicide in their school and suicide and perceptions of risk and protective factors associated with youth suicide in the local community. Themes for perceptions of risk and protective factors fell into levels of the social ecological framework. The next 2 slides provide examples of risk and protective factors discussed in the final report. For example, risk factors at the interpersonal or family level included high expectations, parental pressure on students for success, and limited awareness about mental health. At the school level, risk factors included high ratios of students to counselors, no crisis plan, high teacher expectations, and zero tolerance policies. And at the community level, risk factors included traditional and social media and stigma related to mental health and mental health care seeking. Protective factors at the interpersonal or family level included Finally, youth death by suicide has received mass media attention in Fairfax County. Research has shown that certain types of news coverage can increase the likelihood of suicide in vulnerable individuals, and the magnitude of this increase is associated with the amount, duration, and prominence of coverage. A scan of media related to youth suicide identified 13 news stories. News stories were reviewed and evaluated based on strategies to avoid and the recommendations for reporting on suicide that have been developed through a collaboration among the American Association of Suicidology, American Foundation for Suicide Prevention, and other agencies. Strategies to avoid include big or sensationalistic headlines, reporting on suicide similar to reporting on crimes, and referring to suicide as successful, unsuccessful, or a failed attempt. All strategies to avoid were used in local media coverage of youth suicide. The most common strategy to avoid that was used in these news stories included describing a suicide note with 5 stories. 4 news stories also included photos of videos of the location or method or grieving family members, and 4 news stories described the suicide method. Examples of these strategies to avoid were found throughout the news stories, and examples of text are provided in the final report. In summary, a mixed method approach was used to assist the Virginia Department of Health and the Fairfax County Health Department This investigation is not without limitations. First, we did not speak directly with youth in the community. It is possible that they may have differing perceptions about suicide and prevention activities. However, youth voices were represented in this investigation using the Fairfax County Youth Survey. Second, we may non-fatal suicide behaviors because we only examined emergency department visits and EMS responses. And as noted previously, there was a high proportion of EMS responses that did not have age information. Third, with the Fairfax County Youth Survey, omitted variable bias exists. For example, parent focus groups and school interviews suggested academic pressure and achievement were risk factors for suicidal behaviors. However, this variable is not currently available in the youth survey, so we could not further assess this related. Strengths. First, this investigation used a mixed methods approach that allowed for the convergence and corroboration of findings. Second, multiple risk and protective factors across the social ecological model were identified looking at both fatal and non-fatal suicidal behaviors. Third, the data in the investigation represents multiple voices across the community, including youth, parents, and schools. And finally, this Epi-Aid was facilitated by collaboration across multiple local, state, and federal agencies and organizations. Several recommendations based on the data collected during the investigation are detailed in the final report and fall into two categories: programmatic and surveillance. Programmatic recommendations include educate and assist parents on navigating mental health care resources, work to improve care coordination among schools, primary care providers, and mental health providers, create and disseminate a protocol for responding to traumatic loss with an emphasis on suicide, continue to develop partnerships with community organizations and agencies a health communication campaign to educate the community about risk factors associated with youth suicide and the availability of mental health care resources, and develop and implement an evaluation plan for all ongoing and future suicide prevention activities. Surveillance recommendations include continue to monitor trends in suicide-related behaviors among youth through local data sources, continue to assess the community's perceptions of youth suicide, add items to the Fairfax County Youth Survey to assess perceptions of academic pressure, extracurricular activities, and course load, and consider social media monitoring as an active surveillance tool to identify discussion about suicide or suicide-related behaviors in real time. In conclusion, this investigation into risk factors found that contrary to the common myth about suicide, that most suicides happen suddenly without warning, youth who died by or attempted suicide in this community typically had multiple risk factors for suicide before an attempt was made. Risk factors included mental illness, substance use, and victimization of violence. There was also community concern about increasing access to and decreasing achievement and the role of mass and social media, demonstrating that youth suicide is a public health problem with multiple levels of influence that will require a multi-level response for ongoing prevention efforts throughout Fairfax County. Thank you, and Dr. Gloria, I will turn it over to you all for questions at this time.